Hey guys, my name is Tulshi. I'm here to talk about ACE inhibitors. It's for advanced pharmacology for Dr. Skylar Moore. I'm an Auburn University FNP student. Start off with ACE inhibitors. It's an angiotensin converting enzyme. These are just some example of ACE inhibitor, most commonly known as lisinopril. What does it do? It causes angiotensin 1 from converting to angiotensin 2. Therapeutic effects: causes relaxation of the blood vessels, lowers blood pressure, a reduction in blood volume, and it reduces the effects of diabetes on the kidney. A cute little meme here: April, not sure if it's a month or an ACE inhibitor. Anything that ends in PRIL, ACE inhibitor. And over here is another cute little picture of the AAA system and how ACE inhibitors affects the organs in the body. Pharmacodynamics, like I said, keeps angiotensin 1 from converting into angiotensin 2, causes vasodilation, decreases blood pressure, decreases sodium and water retention, decreases intravascular volume. Some of the common side effects are dry cough, less common abdominal pain, joint pain, fever, diarrhea, headache. Another cute little meme over here: the 4 commonly used ACE inhibitors and what they're used for: hypertension, heart failure, post-MI, and just some of the side effects that are usually associated with ACE inhibitors. Pharmacokinetics of ACE. Administrations administered orally. Absorption is absorbed in the intestines. It's metabolized in the liver. Another little picture here on how that affects in the body, how all that occurs in the body. Pharmacokinetics: continued excretion, about 60% in the kidneys, about 40% excreted in the waste. All of the ACE bind to tissues and plasma protein when they're excreted. These are just some common examples. Lisinopril is included on the ones that are renally excreted. The use of ACE should be cautiously used. Hypertensive reactions, pregnancy, breastfeeding, absolutely contraindicated. You cannot use if angioneuritic edema, if they've had angioedema of the lips and tongue in the past, a pregnancy, renal artery stenosis, related allergic reactions. Just remember, if they come in with swollen tongue, swollen lips, just remember this me, like Mick Jagger, it's usually because of an allergic reaction, and 90% of the time they're on an ACE inhibitor. Not sure if it's from another drug, if it's something you ate, the cause is still unknown. Clinical use for ACE inhibitors: heart failure, MIs, hypertension, renal failure. You can also use it for albuminuria, hypertension, like I said, cardiovascular disease. The terminal half-life considerations when you're prescribing it is terminal half-life 11 hours. How long you want the antihypertensive effects to last, and the route of elimination. If they have kidney problems, you don't want to prescribe them, usually ACE inhibitors. Monitoring when it comes to these patients: regular and continuous monitoring for ACE inhibitor is recommended. You're going to want them to come in every week or 2 weeks, especially when they're started on an ACE inhibitor. Every time a dose is changed on an ACE inhibitor, you have to start all over again. And if they're on it, they need to have continuous follow-up at least once a year. And patients that are high risk, especially diabetics and kidney failure patients, they're going to be monitored more frequently. Another picture over here is just some adverse symptoms and what you're going to educate your patients regarding ACE inhibitors on what to look for. Monitoring continued: you're going to monitor their blood chemistry, such as potassium, and you're going to start them on potassium supplements or potassium sparing diuretics if they need it. You're going to advise them about NSAIDs and not using too many NSAIDs as well. And once again, you're going to start them on the lowest dose possible. Lifestyle changes: adherence to a good diet, low salt, high potassium, no alcohol, everything that we teach our patients about. Exercise reduction, no tobacco, increased physical exercise, managing stress. This is another cute little picture on how ACE inhibitors work. Just remember the key takeaways. April, home care patients definitely strong, and ketanopro. These are some of the medical uses and side effects. These are just a little saying to remember on what ACE inhibitors are used for. These are my references, and thank you guys for watching.